Hi friends, in this part we are going to discuss Tit-bits in Neonatology Clinical Practice Part 3. Myself Dr. Haris, and in this part we are going to discuss postnatal mother side ward, and our objective are 100% early breastfeeding, and if previous unexplained death then workup is must, and adequate counseling before discharge. So for early breastfeeding establishment proper positioning we must know and apply. The four key points are: mother should support the baby's whole body, like in this figure. Second, mother's head and body should be straight. Third, baby's face should face mother's breast. And fourth is baby's body should be close to her body. And for proper attachment, four key signs are: first is more areola should be visible above the baby's mouth than below it. Second, baby's mouth should be wide open. Third, baby's lower lip should be turned outwards and the baby's chin should be touch the breast. Let us discuss problem in breastfeeding. First is inverted nipple. Inverted or retracted nipple sometimes make attachment to the breast difficult. A pump or a plastic syringe may be used to draw out the nipple. So how to use a plastic syringe? Before each breastfeeding, 10 times on each breast a plastic syringe should be applied. And how can we apply? First is cut along the line with blade. Then remove the plunger from its original place and insert it from the cut end. And then mother gently should pull the plunger. It will create negative pressure and will make nipple for breastfeeding. Let us discuss sore nipple. Causes are incorrect attachment of the baby to the breast. Second one is frequent washing with soap and water. Third one is pulling the baby off the breast while he is still sucking. Fourth one is candida infection of the nipple may also cause. So let us discuss what are the treatment options. First one is correct positioning and latching of the baby to the breast. A mother would be able to feed the baby despite sore nipple if they approach properly. Second is hind milk should be applied to the nipple after a feed. Third is nipple should be aired and allowed to heal in between feeds. Mother can clean breast and nipple once daily at time of bathing. Let us discuss breast engorgement. Cause is if feeding is delayed or infrequent, or the baby is not well positioned at the breast, the milk accumulates in the alveoli. As milk production increases, the amount of milk in breast exceeds the capacity of the alveoli to store it comfortably. Such a breast becomes swollen, hard, warm and painful and is termed as engorged breast. To prevent it, early and frequent feed should be given and correct attachment of the baby to the breasts. And for treatment, local warm water packs, breast massage and analgesic to the mother to relieve pain, and milk should be gently expressed to soften the breast. So what are difference in full breast and engorged breast? Full breast on day 2 to day 3 after birth, hot, heavy, and milk is flowing from full breast and fever is uncommon. And in engorged breast, as we discussed, is painful, edematous, tight, especially nipple area shiny, may look red, and milk is not flowing, fever is common. Let us discuss about breast abscess. If a congested, engorged breast, an infected cracked nipple, or a blocked duct and mastitis are not treated in the early stage, then an infected breast segment may form a breast abscess. Mother may have high grade fever and raised blood count. Treat with analgesic and antibiotic, and mother should continue breastfeeding. Let us discuss breast milk expression. If a mother is not in a position to feed her baby, like an ill mother or preterm baby or working mother, she should express the milk in a clean, wide mouth container, and this milk should be fed to her baby. Frequency should be 2 to 3 hourly. Mother should take adequate rest, 6 to 8 hours sleep without any stress and anxiety to increase the milk output. So for milk expression in step 1, ask the mother to wash her hand thoroughly with soap every time before she expresses. Make herself comfortable being near your baby, or having a picture of them will help. Gently massage the breast. Hold the container under her nipple and areola. In step 2, place her thumb on top of the breast at least 4 cm from the tip of the nipple, and the first finger on the underside of the breast opposite the thumb in C-shape sides. In step 3, press back toward chest. Gently squeeze and release the breast tissue between her fingers and thumb a few times. In step 4, repeat step 3 at different position around the areola. Compress and release all the way around the breast, keeping her finger the same distance from the nipple. Express one breast until the flow of milk slows and milk only drips out. and then express the other breast until the milk only drips. And this procedure can be alternate between breasts 5 to 6 times for at least 20 to 30 minutes, and stop expressing when the milk no longer flows but drips from the starting. Let us discuss previous unexplained death history in maternal history. For it, fill early neonatal death or forma for all unexplained sibling death. For example, a term well baby on breastfeeding having no respiratory distress, no lethargy, and had sudden death on day 3. For it, make provisional diagnosis and do workup accordingly. For first line workup, do saturation, ECG, four limb blood pressure, metabolic workup, glucose, lactate, ammonia, acidosis, and ketones. And also do hemogram if we also put differential immunodeficiency in previous baby. Let us discuss counseling before discharge, counsel mother for danger sign of baby regarding immunization, and family planning. Family planning is important because it will allow appropriate resources uses and adequate development of child. Discharge should be made on previous day, and record keeping is important part. Thank you.